Following our Joshua Avisher interview, we decided to bring a special guest to our studio to discuss gender-affirming surgery and answer all of our questions. Today, our special guest is Dr. Edward Ray. Dr. Ray is a Los Angeles-based plastic and reconstructive surgeon specializing in microvascular reconstruction and gender-affirming surgery. He was born and raised in Rochester, New York. After graduating from the Mayo Clinic School of Medicine, he completed his general surgery residency at the University of Rochester. He spent 2 years in basic science research during residency and then went on to receive fellowship training in plastic surgery at the University of Southern California. I'll forgive you for that because I'm a Bruin. He then started a plastic surgery practice in Chapel Hill, North Carolina, and helped found the North Carolina Specialty Hospital's Hyperbaric and Wound Healing Center. He served as both vice chairman and chairman of surgery at Duke University's Duke Regional Hospital. Seeking a collaborative academic practice environment and a chance to help build a microsurgery program, he sold his practice and pursued a fellowship in microsurgery and complex reconstruction at Memorial Sloan Kettering Cancer Center. Following this, he was invited to join the academic plastic surgery practice at Cedars-Sinai Medical Center in 2016. Dr. Ray performs a wide breadth of reconstructive surgery and has a particular interest in microsurgical reconstruction of the head, neck, extremities, and breast, as well as gender-affirming reconstructive surgery. Welcome to our show, Dr. Ray. We are so happy you could join us today.
Thank you for having me. Excited to be here.
Thank you. Dr. Ray, you are one overachiever, and that is why you are so hired to do my mommy makeover.
All right. All right.
We know you. We know you personally, and we just love everything about you. So welcome to our show.
Welcome, Dr. Ray. I'm so happy that you're on the show. I know how busy you are, and it took some time to collate the time, but I'm so happy you're here today. But before we start our show and get into the seriousness of the show, as we told you, Karen and I are the Cedars-Sinai fans. We know every hallway, every pathway, almost every doctor. And for years, over 36 years, since we were teenagers, just to understand, we were like those teenagers, instead of going like to bars and hanging around with friends, we would we would be at the plaza level and eating at the cafeteria in the South Tower or the North Tower, actually. So we decided we're going to put an end to our competition. And today we are going to make you the judge of our of this. You're going to crown the Queen of Cedars today. So basically you'll ask us 5 to 6 questions. We're going to ring a bell. We'll have to say our name because you can't see the bell. Okay. And you'll decide who rang the bell first. Whoever answers gets 1 point. The person with the most points gets crowned, and we're going to put this competition to rest. So.
All right, Dr. Ray, who's your money on, me or Etty?
Oh boy, yeah, that's a loaded question here.
I'm Israeli. I'm Israeli.
It's going to be a tie.
Etty, I have one thing to say to you. I am going to beat your Israeli tuchus.
And I'm going to beat your Spanish culo.
You did not say that.
Before we start, Dr. Ray, before we start the game, I just want to let our viewers know that today we are going to discuss with Dr. Ray the subject of gender-affirming surgery. Gender confirmation surgeries are performed by a multi-specialty team that typically includes board-certified plastic surgeons. The goal is to give transgender individual the physical appearance and functional abilities of gender they know themselves to be. And we're going to go into the seriousness of the subject right after the game. So, Dr. Ray, are you ready?
I'm ready. Let's do it.
Okay, so you are going to ask us the question.
And Etty, you cannot, you cannot ring the bell till he's completely done reading his question.
Okay. She knows already.
All right. Okay, first question. If you needed to get your blood work done at Cedars, where would you go?
Etty.
Wow, that was fast.
I got it.
Karen.
you would go to Plaza Level. There's a lab on Plaza Level, and you would go there, or you could go to the 5th floor of the East Tower also to get your.
Wait. Is it the South or North Tower?
No, I just said the East Tower. You could go to the.
Well, there's
5th
2 locations you said, right?
5th floor, East Tower, or Plaza Level. There's a lab on Plaza Level near the Starbucks.
Okay. Good enough, Karen.
All right, I guess, yeah, I'm actually kind of surprised you got the East Tower one because I had to look this up and make sure I knew all the locations, and I didn't know about that one. So you guys.
I didn't either. I only knew about the plaza, but I wanted to admit that on we're recording. So.
Yeah. All right. So this isn't like Jeopardy. You don't have to state this as a question. You just got to give the answer, right?
Okay.
Fine. All right. Okay. Next question. Let's see. If you were to get an X-ray or an ultrasound, where would you go? Oh, was that a tie? A bell tie? Who got that one?
It was me. That is me.
Oh, okay. Etty. All right. Let's hear it.
It's not you.
I would go to the Mark Taper building.
Okay.
Well, I know another place you could go to.
I was going to say there might be another acceptable answer.
The Heart Institute as well.
No, you could go to the East Tower on the street level.
I want to admit what I did.
That is, well, okay, so how do we decide this here? If you both get
so where would
credit?
So you'll decide which one is the more popular one.
Okay, actually, we can give, there's a tiebreaker to this question. There's one more location, particularly for if you were going to get an ultrasound or a 3D mammogram.
Oh my God, on San Vicente, the cancer center. It used to be the cancer center, and now it's called the San Vicente building. Is it called?
That's where Dr.
The mammogram, it's on the 3rd level of the San Vicente building, but I remember, it used to be the, let me remember the name.
Too late.
Okay, but I got it more than you. Wait, is that San Vicente?
The answer I was looking for was the breast center, which is on San Vicente.
Oh, see, it used to be it used to be the cancer center, and now the cancer center is across, and now it's the breast center, on the 3rd floor on the San Vicente.
All right, well, I guess she came up with an answer that was pretty close. I think we should give it to her.
So we are tied right now.
Makes it interesting because now you got a tie. Okay. Now we're gonna like warm things up here a little bit. So if you were looking for a kosher meal, where would you go at Cedars?
Karen.
You rang it before to ask the question.
Well, I said my name.
Cheater.
Well,
that's the question. So if you wanted to get a kosher lunch, where would you go?
You go to the hospital South Tower, and they have in the refrigerator section, they have like pre-packed kosher little boxed sandwiches, and you could get it there.
Wrong. It's in the North Tower. It's the North Tower, not the South.
Oh.
Actually, Karen is correct. It is technically the South Tower where the cafeteria is.
Really?
On the street level.
I thought it was on the North Tower.
Yeah, the North Tower at that same location is the emergency department. It's across the street.
Karen!
Now,
I'm heartbroken.
No, you know what? I'm really surprised you guys knew this because a good friend of mine, a colleague here who keeps kosher, I was asking him this question, and he said that there was 2 cafes that used to have kosher food, but no longer do, surprisingly, in the medical office towers on the plaza level. So those answers would not have been acceptable, but you guys apparently knew that. So
wow,
impressive.
Okay, so 2-1. Ken, if you're going to win, I'm going to be heartbroken.
We still have a few more questions here.
Okay.
And I'm kind of saving the ones that have multiple answers for last here, okay? Because I want to see who can get the most answers correct.
Okay.
All right. So next question: if you wanted to get some money from an ATM machine, where would you go?
Etty.
I said it. Okay. You could go to the Wells Fargo ATM.
Which one?
In the East Tower on street level.
Okay, east.
Oh, and there is, I would go to the ATM on the plaza level right next to Starbucks.
Okay, you guys got 2 of them, but you're actually missing at least 1 more.
Okay, so I'll tell you.
In the gift shop.
Wait a minute. I'll let, let's see, who had the last correct answer? I think Etty had the last correct answer.
So Karen, you go.
So in the gift shop, Etty told me that once.
You're using
one in the gift
information
shop.
I gave you against me.
If there is, somebody took it. There's no more ATM there.
When I was looking to take out money, you told me, oh, in the gift shop.
Yeah, she meant you were going to have to like rob the cash register to get money. That's what she meant. No, but there is 1 more that you guys are missing. Accessible to the public. I had to ask a security guard to find it.
Well, I'll tell you. Is it next to the temple on the plaza level?
Mm-mm.
There's Wells Fargo Bank.
Yep. So the bank is in the East Medical Office Tower, and then you got the one that's the obvious one in the plaza level that you always see. But there's 1 more hidden. See if you can tell where it is.
Well, we only need 1.
Oh my God, is it,
Don't you want bonus points?
At the Heart Institute? Is it in the Heart Institute right next to the parking structure?
I'm not aware of one there, and I've poured over the maps to try to find all the ATMs.
Oh
All right, I'll just tell you guys, there's one in the cafeteria. There is actually one in the cafeteria in the back by all the vending machines.
Oh, I didn't know that.
In the hospital cafeteria? Oh.
There's
So
actually
we're
2
still
of
a
them.
tie? Are we still a tie?
There's one, it's like Southern California Credit Union, and the other one's Wells Fargo. There's 2 of them.
Oh, wow.
Wait, so what's the score now?
One
Still tied, right?
tie. We're tied.
Hi.
Yeah, 2-2.
All right.
Okay, so here's the tiebreaker. This is the big one here, but there's multiple answers. So even if you don't get the first one right, or even if you do get the first one right, there's still a chance for the other one to catch up. If you want to buy a cup of coffee, where would you go, and what brand coffee would they be serving you?
Karen.
Etty.
Okay.
You have to get both parts to get credit.
If I wanted a brand coffee and where I would find it, so I would go to Starbucks, my favorite. I go there every time.
Okay.
And it's on plaza level, and it's by the elevators.
Okay.
I'll
So
go to the
Starbucks
restaurant in the plaza level. There is a restaurant on the plaza level right next to Starbucks that all the doctors go to, and that's where I would get my coffee. I would get it at Starbucks first, but you beat me to it.
Now, the only reason I'm not going to give you credit for that is it's closed. That's the Plaza Cafe.
Okay.
And it's closed because it's under construction. They're revamping it or something.
Okay, so the cafeteria.
But there's a few others. Yes, cafeteria. Now, do you know what brand coffee they serve?
I think they also serve Starbucks coffee.
It's a good guess, but
if you wanted a brand coffee, you could also go to Coffee Bean, which is on Plaza Level 2. It's also there when you enter when you're entering to go to the towers.
Yep.
You could go to Coffee Bean and get
which tower is it?
That's the hold on. That is the East Tower.
Oh, very good.
And I'll go to the Saperstein. Wait, I would go to the Saperstein, right next to the Saperstein building.
What kind of coffee do they serve?
Bakery, to the bakery there. Is that a good answer?
So, okay, that's okay. But can you tell me what brand coffee they serve at that?
Oh, I don't know. You said Coffee Bean. That's pretty good. I have no idea.
What's that?
Starbucks or Tester's Choice? I don't know. Starbucks. I would go with Starbucks.
It is Starbucks. Now they keep changing the name of that cafe. It's actually not like a little bakery anymore. It's different, but they still serve the same coffee. Now there's one more place. So right now Karen's ahead. Eddie, if you can tell me the other place, you can tie it up. There's one more place where you can buy coffee.
I'll tell you, the Heart Institute. There is in the Heart Institute, there is in the second floor, I think, second or third floor, there is a cafeteria there in the Heart Institute that you can order coffee and sandwiches, and they serve Starbucks as well.
I don't know about
100%.
I don't know if that's open to the general public. I've never been there.
Oh no, it is. It actually is. Where you go check in for the Heart Institute, on that level where you go to the elevators, all the way to the right, there's the cafeteria, and it's open to the public.
Give me a couple of minutes. I'll go check and then I'll find out.
Check it. And it's on, because I'm there all the time visiting Fertility Esmalian. He's a friend of mine, and that's where we drink our coffee.
Okay, well, I know Fardad, so we'll
he's amazing.
Give you credit for that, but you're missing a really important coffee shop at Cedars. And it used to be known, I'll give you guys a clue, it used to be the La Brea Bakery, but it changed names.
Oh, it used to be the La Brea Bakery. That's the one next to the Saperstein building.
It is. Do you know what it's called?
Kelly's?
No. Bagel something, no bagel. Not Bagel Nosh.
Oh, wow. What is that called? I've seen that. Yeah.
They just changed names. So it's during this whole COVID thing.
Then I would not know.
All right. That's probably not fair, but you were correct. It is right next to the Saperstein building. I think it's called Zine now.
We were there.
Oh, wow. They gave it such a because they have La Brea kosher, the actual kosher. So for Dad Esmalian, he is the best. I love this. Yeah. He saved my husband's life.
We have a few patients in common. I've helped him out a little bit in some of his reconstructions. He takes care of some very, very sick patients, and we help them out, when they have some healing issues and things.
Wow.
He's a mensch, as we say. I love it. It's so funny. I just wrote him an email the other day.
All right, so who's
my daughter's mentor? My daughter just started a surgical residency, and that's what she aspires to be, is Dr. Esmalian.
Oh, okay. Well, I someday want to grow up to be Dr. Esmalian, to be honest. He's a mensch. He's a great guy.
Wow.
I don't know. It's hard to say who won here, because I kind of led you guys on a little bit in the end there, hoping that you guys would get all the coffee shops. But I don't know. I think Karen was ahead by a hair.
Karen.
Fuego. Okay. Oh my God.
We're going to take Dr. Reiko to Miami with us.
Look at that.
Oh my God. You know what she's going to do? Until we're 100, she's going to shove it in my face. Oh my God. I'm not airing this episode.
Oh my God, you're so funny. But now it is time. Thank you, Dr. Ray, for being such an amazing sport and playing that game show with us. Now, of course, we want to get to the seriousness of our topic, because you are, very skilled, and we need to share with our audience all your knowledge and information. And, I wanted to start with our first question for you. I wanted to ask you, where is the technology holding at this point for phalloplasty? And where is the skin coming from? And how successful is the urination pathway?
Oh, wow. These are really specific questions. Well, first of all, I just want to, give a shout out to all the people here at Cedars who do gender affirming surgery and who are also part of our team. It wouldn't be right for me to not at least acknowledge them. The director of our program is a doctor named Maurice Garcia, who's a very talented urologist and trained in gender affirming surgery, and came to Cedars here to start the program about the same time that I came here about 5 years ago. So shout out to those guys. And of course, there's any number of doctors, nurses, and other staff members who really help make this program what it is. We take care of a lot of patients who come here seeking help because they've been diagnosed with gender dysphoria, meaning they don't identify with the gender that they were assigned at birth. And so, everybody has a little different combination of things that are causing their dysphoria, different parts of their body that are particularly, affecting them. And so we sort of tailor our approach to each individual's concerns. And of course, everybody is screened, everybody goes through a process. They typically spend some time in counseling with a therapist and working through some of the causes of their concerns and their issues before they're referred for surgery. So, I just want to make it clear, we really take this condition seriously, and usually surgery is something that comes down the road. Most patients end up on some kind of hormone therapy for a while, they have to live as their, identified gender, excuse me, for a period of time, usually a year to 2 years before they come to us for surgery. So by the time we meet our patients, they've already established that they're comfortable in their living as the gender that they identify with. But to answer your question, so phalloplasty refers to basically a female to male patient who's looking for what we call bottom surgery. So meaning they're looking to have their genitalia reconstructed to appear as male. And there's a few different ways you can do that. There's actually several options available to those patients. Phalloplasty implies that we're basically making something that looks and functions like a penis. But there are some patients who aren't quite ready for that extreme of surgery. And there's kind of like little hybrid surgeries that we can do. There's a procedure called meticulous, which kind of changes the anatomy a little bit, but doesn't fully create a new penis. So phalloplasty is an operation that's been around, actually, believe it or not, since a little bit before World War II. There was a surgeon who's very well known in the plastic surgery community named Harold Gillies. So he was a New Zealander, and he moved to Europe to help out in the war effort for World War I. And he ended up staying there and established a clinic and took care of a lot of patients in the United Kingdom. And he actually performed one of the first known phalloplasties because he did have some patients, including some former war veterans and who were looking for gender-affirming surgery. But he took care of both female to male, male to female patients. And he performed one of the first known phalloplasties. The techniques they were using back then were a little bit different because we now have a lot more knowledge about how to move tissue from one part of the body to another. And if you're going to make a penis, it has to be living tissue. It has to be something that you can give sensation to. You have to be able to hook up a nerve, if you will. And so in plastic surgery, we have kind of a subspecialty called microsurgery, because those of us who do microsurgery, we specialize in taking tissue, moving it from one place to another. And then under a microscope, we can hook up an artery and a vein to keep that tissue alive, moving it, from one place to another without it dying. So this is a perfect application of this technology. And microsurgery has kind of been around in one form or another since about the 1960s. So it's newer, but it's been utilized for a while.
Where is the skin coming from?
So there's a few options. Anytime we move tissue from one place to another in the body and reshape it, we call that a flap. So that's the term we use, a flap of tissue. We move it from one place to another. And when you're doing or creating a phalloplasty, you have a few options. Probably the most popular option is actually taking tissue from the forearm. So you can actually take the skin from the forearm. You take a big enough piece. We basically take this piece and roll it into sort of a tube within a tube. So the skin on the outside, part of that becomes the inside, or the urethra, which is, the tube where the urine comes out. If a patient desires that, not every patient wants to have that part of the operation. But if they want to be able to stand up to urinate like a cisgender guy does, then they have to have a urethra lengthening. The other part of it is the skin on the outside of the penis, and that sort of becomes the outside of the wrap, if you will. And coming from the forearm, it's very reliable because there's all kinds of blood vessels and nerves that we can use for that purpose.
Wow. And is the urination pathway successful now, or how is that working out?
Most of the time it is, but there is a high complication rate because it's sometimes hard to get that tissue to heal the way we want it to. And people can get little scars and things like that inside the tube that makes it hard for the urine to come out properly. So sometimes we have to go back and do revisions to fix that. But, for the vast majority of patients, it works, and it works well, and, gives them a chance to live in the gender that they identify with.
Would you say more people want that type of surgery, or more people shy away from it?
I don't know the exact numbers, but I will say more transgender men, meaning female to male transgender patients, start out with the chest surgery, basically remove the breasts, and they do a mastectomy. That's the most common operation that we do, or at least that I do in my practice. And I would say similar things for transgender women. In other words, male to female transgender patients. Many of them will come looking for basically a breast augmentation to give them breasts, female breasts, and fewer of them go on to get the bottom surgery. It's,
Actually, this falls right into my next question. When you said that, how often do trans people ask about preservation of the fertility now, as opposed to a few years back? And also, if a trans person wants to remove their breast, but wants to retain the ability to breastfeed in the future, can they do that?
Interesting questions. So the fertility part of it is a very important topic because, if you're going to do, especially the bottom surgery, if you're going to remove parts of your body that give you the ability to procreate, and those go away, it's going to be very difficult and essentially impossible at that point to ever have children. So what most centers do, including ours, is patients will be asked if they want to, for example, for a transgender man, if they want to freeze their ovaries or freeze their eggs and for future use for possible artificial insemination later, that's a possibility. They can do that. There's technology for that. And similarly for transgender women, if they want to freeze their sperm. So, those options are available. I don't know what percentage of people go for that. I don't have the data on that, but it's probably a minority of patients. I think most individuals are not taking advantage of that, and some of that may be cost related. I mean, it's some of that you probably end up having to pay at least part of it out of pocket. I don't know that insurance covers that. And then your other question is about breastfeeding once you've had a mastectomy. We really don't have a way of preserving either breast milk or breast tissue long term, so we don't really have a way of doing that. So breastfeeding would be difficult. Now, for a transgender woman, it would also be difficult. So even after taking hormone therapy and getting some breast growth, it is difficult to produce enough milk to really breastfeed, even if you were, inclined to do so.
I wanted to ask you, go back to the other subject. Once you put the penis together, does it function the same way as a regular man? Like a man that was born a man?
Well, there's some important differences. I mean, it's skin and soft tissue. It doesn't have all the other parts of the penis. So we can hook up nerves and give them some sensation. And we have had patients even regain or gain erogenous sensation in their penis. But obviously that individual can't produce sperm. They can have an implant if they want to be able to have an erection. So that is a possibility. But again, it's an inflatable device that's inserted inside the penis as an implant. Yeah. So they can have an erection, they can urinate, and they have what looks like a penis. That's kind of where all the similarities with a cisgender man. That's where the similarities are.
I can't believe I'm going to ask this, but can they have orgasm?
Sure, absolutely, and that's important to people. Individuals don't want to give that up.
No, she didn't ask that.
Well, I mean that's.
I know viewers will be very curious.
It's an important question, and the answer is yes. And when we're hooking up the nerves, we're very careful not to damage. Basically, for example, in a transgender man, they still have a clitoris, and we're not removing that. We're not damaging those nerves. We're plugging into those nerves so that they could potentially have additional sensation in their new penis, if you will. But we're not removing the clitoris, and so they can still achieve orgasm that way.
When talking to many transgender individuals in our research when we did our interview with Joshua Avishur, which was a very successful interview, a lot of the transgender individuals stated to us, like, quote unquote, it's easier to make a hole than a pole. That's what they would say. In exactly that language. It's easier to make a hole than a pole. Could you elaborate a little bit on that?
Yeah, well, I mean, it kind of makes sense, if you compare the female and the male anatomy, you need a lot more material to work with if you're going to make a penis. I don't know how else to phrase it. You know what I mean? It's just, you have a protuberance that wasn't there before. You have to get that tissue from somewhere. But
Are
if
you
you're
regretting coming on?
No.
so, yeah, the operations are very interesting how we do them, but yeah, it's true. I mean, it is technically a more challenging operation in several ways to do the female to male bottom surgery than the other way around.
Wow.
Dr. Ray, last year marked 25 years since the story of Lorena Bobbitt cutting off her then husband's John's penis. Lorena, it's funny, but it's not. Through his penis, I remember, you know, I was younger and I was like, I can't believe this happened. Yeah. Through his penis into a field. She then led authorities back to the field, and miraculously, the penis was found. The penis was reattached after being taken to the hospital in a famous 7-Eleven hot dog weenie bag filled with ice. So essentially the weenie was taken to the hospital in a weenie bag.
Did not just say that. The weenie was taken in a weenie bag.
Only Etty. Don't tell Dr. Ismalian to say that. Can you explain exactly how John Bobbitt was able to have a successful penis restoration procedure? Because at first, it didn't look like the doctors are going to do it. And I know that originally he was not going to have it reattached.
Yeah.
Do you remember this story?
I do. I was like you. I was young. I was a kid. I don't remember how old I was, maybe in high school or something, but
right.
I remember hearing about it and thinking.
Did you ever think that back then that you would be doing those type of surgeries one day?
No.
Like
No. But
maybe the story made you go into this field. No, you felt so bad. You said, I have to be the same.
No, I mean, I think that this kind of points to the amazing things that we can achieve with microsurgery. So what they did was they reattached all the little microscopic structures under a microscope, you know, as many blood vessels and nerves and portions of the penis that actually enable it to function like a penis. You know, they put all the things that were severed, put them back together. It's actually very similar to, you know, when somebody cuts off a finger, cuts off a hand, cuts off an arm, there's ways that we can reattach it. Now, it doesn't always work as it used to because some of those structures don't heal as well. Nerves, for example, are notoriously unpredictable in how they heal. And so sometimes you may not have feeling, or you may not have, you know, the motor function in the muscles that those nerves attach to, but it's pretty amazing. You know, when you cut off a part of your body, we can sometimes reattach it. I don't think anyone's ever successfully reattached a head, so don't
cut. I shouldn't cut my husband's head anytime soon.
So do you think that John Bobbitt, it's functioning for him? Like after they reattach it, he's able to experience orgasms and erections?
You know, I don't have personal knowledge about the answer to that question, but I've heard through others that he was actually a porn star at one point in his career after this. Yeah, so
our producer here is saying he was, so you're correct.
so I think it's working just fine for him.
Wow.
That's the only reason I'm laughing. Otherwise, you know, that's probably kind of cruel to laugh about it.
I'm sure he sleeps with one eye open.
No, I think the key is, you know, don't upset your wife. Be nice to her.
Oh my God.
Wow.
I don't know how she had the guts to do it.
I don't know.
So I want to ask you an interesting question. Why did you choose plastic surgery, and why these specific surgeries? It's fascinating, you know.
Yeah, I mean, it's like a lot of things in life. You know, you start down a path in your career, and sometimes it takes you someplace you never thought it would. I started out as a general surgery resident. Okay, as you said in my little introduction there, in Rochester, New York, I trained in general surgery thinking I was going to be a vascular surgeon. You know, I wanted to operate on blood vessels. And I knew nothing about plastic surgery. I probably thought what most people in general public think about plastic surgery. You know, they do boob jobs and facelifts and, you know, that's it. And there's nothing wrong with that. But I was really turned on to the fact that they do a lot more, that we do a lot more reconstruction, you know, whether it's making a breast for a patient who has breast cancer, or helping somebody who was in a really bad accident, putting them back together. Those kinds of things really excited me. And so, you know, without boring you with all the details, I ended up here at Cedars because, you know, I kind of redirected my career even after going into plastic surgery, you know, being more of a garden variety plastic surgeon. I said, I want to do more of the bigger cases. So I spent a year at Sloan Kettering in New York and did some extra training there to do more microsurgery, and then got recruited to come out here to basically be a microsurgeon. But then serendipitously, at the same time that they recruited Dr. Garcia to start the transgender program. So I was approached and they said, you know, we need a microsurgeon to do some of these cases. Are you interested? And I said, sure, let's do it. You know, I want to help people, and it's a different kind of surgery than I imagined I'd be doing, but sure, why not? And it's been amazing, you know.
What are your hours like? You don't, because, you know, I know Dr. Ismailian, you know, one time, you know, he was at the hospital at 5:30 in the morning. And then I was waiting for one of my cousins in the waiting room. And I see Dr. Ismailian at 11:30 at the hospital, and he didn't even go home. And I was like, you're still here? And he's like, yes, I'm still here.
Yeah, surgeons sometimes feel a little bit like robots. You know, we just got to get a job done. We don't worry so much about what the hours are. But, you know, it varies from day to day. I don't want to scare anyone who's thinking about going into to plastic surgery or any kind of surgery that the hours are horrible. But, you know, there's some days we're here until very late, like those phalloplasties. I mean, that's an all-day operation. And we're here till 9, 10, 11 o'clock at night sometimes, even when we start the surgery at 7 in the morning. But you know, there's other days things are much easier and we get out of here by 5 o'clock. So it's kind of variable, but you do have to be willing to work some long hours some days. Dr. Ismailian is a whole other character though. He's
I wanted to know,
one of a kind.
do you really carry on a relationship with the patient after the surgery also? You know, I'm sure there's like an emotional connection there.
Yeah, I mean, I think there is, you know, it's, that's why we do what we do, you know, to sort of get that sense that you've helped change somebody's life for the better in a way that they see themselves in a much more positive light. You know, that's kind of, that's what we're really striving for. So most of the kinds of surgeries that I do really, you know, there's some kind of dramatic change that the patient sees, whether it's putting them back together or doing some kind of gender affirming surgery. You know, those are the things that keep us motivated.
Or my future mommy makeover.
Absolutely.
I'm sure your wife wakes up every day. Oh, I'm married to a plastic surgeon. I need Botox.
You know, early on it was like that. She was always asking for Botox and fillers, and I just finally told her. I said, "You don't need any of this stuff."
Oh, so sweet.
You know, I had to cut her off at some point.
Right.
I don't think any of you guys need any sort of surgery either, just for the record here. Yeah. I'm just humoring you.
Oh, I need a surgery.
Yeah.
It's so nice. You know what I told Karen this today when we were like right before? I go, Karen, we are going to have a plastic surgeon on. I'm so happy that they see only the top part of see the, because I can see it going through your head. You know, this one I can cut here, and there.
Not at all. Not at all. You know, I could turn it on and off. I don't think about people that way when I'm looking at them. So
how do you like Cedars?
Oh, Cedars is amazing. I mean, this is like the pinnacle of my career, being in a place like Cedars.
Oh.
You know, it's obviously got a national, international reputation. So it's a great place to work. They take good care of their staff. It gives me a lot of opportunity to do research, to work with other people who are really smart in their fields, to come up with cool ideas for new research projects. We get to teach. You know, even though we don't have a medical school here, we work with medical students from UCLA. So go Bruins, right?
Yeah.
And there are a lot of residents here in surgery and other subspecialties. We don't have a plastic surgery residency. Maybe we will someday, but we do have a fellowship. So we train, we just started a microsurgery fellowship. Dr. Sherman, who's my boss, was able to get some money donated for that. So we now have our own fellowship.
I know Dr. Sherman as well. He's amazing.
Yeah, he's the one who built this program. You know, he was the first academic plastic surgeon at Cedars. So, you know, I wouldn't have all those opportunities if I wasn't here. That's why I gave up my practice back east to be at Cedars.
Is it hard to move the family around to get them to agree to, because you know, my daughter now is like in her 20s and she just started a residency, her first year in as a surgical residency. And as a mother, I'm like, okay, now it's time to date. And she's like, Mom, the time I have, I'm going to sleep. I'm not going to date anytime soon right now. It's too hard. And I'm like, Lizzie, but eventually you have to start thinking about family. And you know what she told me? Mom, if you want to date so bad, why don't you go on J-Date?
There you go. Throwing it right back at you. Yeah.
You know, Dr. Ray, I wanted to know right now, because of the given situation with COVID, are you being asked to work in the ER and assist? Because my understanding is that now a lot of the doctors are stepping up and helping out with COVID because there are so many patients flooding the ERs. And I was wondering, what's your role in all of that?
Well, no, I mean, it's a good question. These are really tough times that we're dealing with, we're living through right now. And, you know, there's a lot of places where there's sort of bottlenecks in the system. Right now, actually, from a staffing standpoint, we're doing okay. It's the beds, you know, there's no place to put them. So the space in the hospital is what's really limiting things. Fortunately, a lot of people are stepping up. You know, everyone in our department is volunteering to help out any way we can. Because as you can imagine, we're not doing a lot of elective surgery right now.
Right.
So, for example, I'm actually getting trained how to give vaccinations. So I'm possibly going to be giving people shots to vaccinate them against COVID because they just can't get people vaccinated fast enough. And there's you know, thousands of doses that are waiting to be given to people, not just the staff, but the public. So so we're working on it. A lot of us, you know, nurses, physicians, staff from different specialties are all coming together to help out in that way.
So when would the shots be available to the general public?
We don't know yet. You know, our best guess is probably in a few weeks that will happen. In some states, you know, they're already vaccinating people in the general public, but every state has its own plan. In California, they've kind of stratified people based on priority. So, for example, teachers will probably be among the first in the general public to get vaccinated so that kids can get back to schools. You know, but those kinds of decisions are made at the state level. And so I think we're still trying to figure out where those injections are actually going to happen. I assume that Cedars will probably be one of the locations in our area that will be giving out vaccinations to the public. So that's why we're getting ready to volunteer for that.
Oh, wow. Well, I have one more question. The people that you do the surgery, the transgender surgery, psychologically, are they happier after the surgery, or do you see kind of depression of like, we did the surgery and we're not like, they thought that it will be something else?
Yeah, like expressing regret after doing the surgery.
But just maybe disappointment. They would like think that it would be something bigger, or like they'll feel, I don't know, like that there'll be, oh, this is not. Does it really make them feel like they're the gender they identify as, or they're like depressed because there is still an element of like, oh my God, I don't feel 100%.
Yeah. I mean, for every patient, it's different, but I would say the vast majority of patients that I talk to, and I don't have a formal survey, but I do ask them, you know, how happy they are about their choices and where they're at when they're all, you know, at the end of their journey. And the vast majority of patients express that they're really happy they did what they did. Some of them even say they wish they had done it sooner. But, you know, it's for every person, it's different. I've had patients who are, you know, they're 18 years old and they've known since they were a very young child that they were not the gender they were assigned at birth. And for them, it's a very different experience than somebody who's in their 50s or even 60s who comes to me and said they've been living a lie and their whole life, you know, maybe they've even had kids, they've had a whole family, and they're like, this isn't who I am. And it's driving me nuts. But even this late in life, I want to do something about it. And I want to live in the body that feels like it belongs to me. And the one thing that's similar in both of those patient groups is that almost always afterwards, it's a life-changing thing. It makes them much more comfortable in their social environment. They don't feel like people are staring at parts of their body that they don't feel belong to them, things like that. So it is very transformative. Now, it's not to say there's never regrets. I would say once in a rare while, we get somebody who maybe they're kind of like on the border of, maybe they're gender non-binary or something along those lines, and their gender identity is not as fully developed, or maybe there's other reasons why there's some regret. But the vast majority of patients are very happy with that they made that choice.
Mm-hmm. Dr. Ray, before Etty closes us out, can you just share with us what would be like your dream case to work on? Meaning, like, would it be a facial reconstruction? What would be something that you haven't done that is something that
I haven't done?
Yeah, yes, that you would like to see yourself, a case that you would like to see yourself participate on, or or do yourself before we close out?
Wow, yeah, that's a tough question.
Basically, what she's saying, with all your achievements, where do you go from here?
Yeah, wow. I guess I would say, maybe come up with a new type of reconstruction that no one's ever done before. Figure out a way to take a piece of tissue from one part of the body and perform an operation that we couldn't do before. I don't know, that's kind of vague, but everybody wants to have, some great achievement that is their legacy. And I think that would be really cool to discover a new flap, a new way to do reconstructive surgery.
Wow.
So, I'm still young enough. I think, I got some time. Maybe I'll come up with something.
Wow. Well, you have to promise us that if you do, we are the first people that you're going to interview with.
That's a deal. I'll let you know.
That's a deal.
As soon as I get that Nobel Prize.
Yes. Well, you know what? Make sure it's after you do my surgery so I can wear a really beautiful gown.
All right.
Dr. Ray, what an honor it was for us to interview you on Yentas in the City. I'm in love now. Like, I thought I would be at that, and I'm only in love with with Esmalian. Right now, we have a new, it's Dr. Ray. We are adding Dr. Ray to our list of favorites.
Well, thank you guys. It's the honor's all mine. I've seen your interviews. You guys have interviewed some amazing people with incredible achievements. So I feel very honored to be asked to do this. So thank you very much, Etty.
Thank you.
Thank you. Dr. Ray, you are an accomplished surgeon and a leader in your field. Thank you for taking the time out of your very busy schedule to bring so much awareness. For our viewers, although we only discuss gender-affirming surgery today, Dr. Ray is top plastic surgeon at Cedars-Sinai Medical Center. You know he is, because if Karen and I picked him to be here, he's the top. Who specializes in a wide range of reconstructive surgeries, in particular reconstruction of the head, neck, extremities, and breasts. So if any of our viewers is interested in making an appointment with Dr. Ray, we will be happy to provide you with his office number. We will, when we air this, we'll include his office number and how to contact him to make an appointment. We'd like to thank all of our followers for listening to this episode. Please remember, you can follow us on Facebook, Instagram, Twitter, and TikTok at Yentas in the City. You could also write us at dearyentas@gmail.com. We would love to hear from you and answer your letters on our weekly advice column. We'd like to thank our sponsors, Soft Smart System International and Conquest Realty Investments. We hope you enjoyed this episode. We have a lot more coming. This is Etty Elkis and Karen Cohen, and we are Yentas in the City. Stay safe and wear masks.
Thank you.
Thank you.
Thank you.